Yeah, and we talked about you being a team physician for the local high schools and Gary Railcats. Over the last several weeks, we've had shelter-in-place orders where people aren't going out, they're not going to the gyms. The gyms are closed. They're not able to go play their high school sports. What do you think? As sports starts to come back in the summer, and then with fall, with football, soccer, cross country, some of those other sports. What do you think you will see later as those start to open up? Do you think injuries will start to increase a little bit? Do you think everything will be kind of normal again if they're not doing any of their normal workouts or exercise routines? And would physical therapy or a structured exercise program benefit them in any way?
Yeah, this is very classic. It's the athlete that hasn't done anything for quite a few months, and then all of a sudden the season starts and he wants to be back where he left. Uh, you need to have patients need to have in mind that the preparation for the season starts 2 3 months before the first practice, before the first training camp, and that's the reason for that is you need to start conditioning your muscles, okay, doing some sort of strengthening workout before you get to competition, because once you get back to competition, all you do is play. There's no time to do a rigorous schedule for strength and conditioning. Okay, so it's very important that patients, and you see this a lot. For example, take LeBron James. If any of you follow LeBron James in Instagram, the guy is doing 7 days a week at the gym on the off season. Why? Preparing his body for when the actual workload doesn't allow him to do that. So you'll see him that he's constantly in the gym doing sports specific exercises related to their sports. And I think that's when you guys at Ivy Rehab, that's when you can provide some guidance for this patient population, because sometimes they think, well, I go to the gym, do a couple of bench press, do a couple of squats, I'm good to go. No, I mean, you need to progressively get your body to that high end demand. And most of the time with this stay at home orders, patients are staying at home, not doing much. Maryville High School has their first training camp in July. So if they're not active, gonna they're gonna see a few injuries early in the season. Now, once those patients that we're having at the start of the season, so let's get back. The way you see injuries is very early during the season, okay, because of that lack of conditioning. And then those players that have good genetics are natural athletes. They are able to go through the season well. And then you see another group of players that get injury right, a couple of weeks before the season ends. So one group gets injured because of lack of conditioning. The other group gets injured because of fatigue. And that's another important role on the conditioning program that is done, mostly before the season. And there needs to be some structure during the season as well. Maybe you guys can comment on, what kind of guidance you give to people that go to your facilities asking for what, I play basketball, I play baseball, what kind of exercises do I need to do? So maybe that's something that you can comment, because you probably see this more than I do in my practice.
Yeah, thank you. I mean, in January and February is always a good time for us because everyone has their New Year's resolutions. They want to get back to the gym, and they always overload too much. They go, and they think they're going to be Hercules and lift the whole world up in the first week. But from an athletic standpoint, returning from this, I think it's going to be interesting because we're going to need to work with some of these athletes on looking at the whole kinetic picture. So ACL injuries, we're going to see some incidences that pop up because, as most they're saying 3/4 of ACL injuries are non-contact.
Right.
Often we see, in the NFL, we're like, oh, he got tackled and tore his ACL or some sort of trauma, but that's really not the case. So that tells us as healthcare professionals, these can be limited and these can be prevented. So what does that mean for us? That's working on not only quad control, quad strength, but looking at, our hip flexibility, our hip abductor strength, looking at the ankle. Does our ankle move? Do they have a history of ankle sprains? Core control, and then just working on proper running, landing properly, making sure they're not dipping in the valgus, and then just teaching those proper mechanics and just reinforcing that in a positive light.
Yeah. Yeah, like you said, most people have this misconception that ACL injury is, I was playing football, someone tackled me, and I busted my ACL. No, it's most of the ACL injuries are non-contact, and that has to do a lot with obviously the way certain athletes are built, especially females. They have a higher rate of having these injuries because of their shape, the bone shape. But also creating that muscle memory to react, against unexpected situations, like you say, deceleration, changing directions, pivoting, landing mechanics. So all that is neuromuscular training that you guys, I'm sure that you do in your facilities.